Imagine for a moment your kidneys, these small bean-shaped organs, performing a Herculean task day and night. They filter liters and liters of blood, removing toxins and maintaining your body in balance. But what if something goes wrong? What if you were told that everyday habits, choices we make without thinking, could put this vital function at risk? Have you ever stopped to consider the impact of a simple bottle of soda, or how a night of poor sleep can affect your kidneys? Now let's dive into a world where every dietary decision, every drop of water we drink, and even the level of stress we allow in our lives plays a crucial role in kidney health. Are you ready to discover who the villains are in your everyday life and how to combat them? How can you, from today, take the reins of your kidney health and steer your path towards a healthier future? Join us on this journey and prepare to be amazed by the power of simple actions and habit changes that can transform your health in extraordinary ways. The kidneys play a vital role in the human body, acting as essential purifiers and regulators for our health. These bean-shaped organs, located in the lower back on each side of the spine, have the capacity to filter about 120 to 150 liters of blood daily. This filtration is crucial for removing waste, toxins, and excess fluids from the body, thus maintaining the balance of minerals such as sodium, potassium, and phosphate. Moreover, the kidneys play a key role in regulating blood pressure, producing red blood cells, and maintaining bone health, producing an active form of vitamin D. Their function is not limited to the excretion of unwanted substances. They are key pieces in the orchestration of a series of vital processes that sustain life. In addition to their filtering and excretion functions, the kidneys are also responsible for a number of other important tasks. They regulate the body's water volume and the acid-base balance, essential for the proper functioning of our cells and organs. The kidneys adjust the composition of the blood, ensuring that levels of electrolytes and pH remain within healthy ranges, fundamental for the organism's proper functioning. The kidney's ability to respond to hormones, such as renin, which regulates blood pressure, and erythropoietin, which stimulates the production of red blood cells, highlights their role in the interconnection of bodily systems, showcasing the complexity and importance of these organs for overall health. Taking care of kidney health is, therefore, indispensable for maintaining health and well-being, directly reflecting on the quality of life. Dehydration occurs when the body loses more fluid than it takes in, which can have serious repercussions on kidney health. The kidneys depend on an adequate volume of water to function efficiently in filtering the blood and eliminating waste through urine. When there is a lack of water, the blood becomes more concentrated, and the blood flow to the kidneys decreases, hindering the filtering process. This can lead to the accumulation of toxins in the body, increasing the risk of kidney stones and other serious kidney conditions. Furthermore, prolonged dehydration can cause damage to the kidneys over time, compromising their ability to perform their vital functions, underscoring the importance of hydration for kidney health. To maintain adequate hydration and protect kidney health, it is essential to adopt habits that ensure a regular intake of fluids throughout the day. It is recommended to drink at least 8 glasses of water a day, but this amount can vary depending on the climate, level of physical activity, and individual health needs. Including water-rich foods, such as fruits and vegetables, in the diet can also help increase fluid intake. Additionally, it is important to be aware of signs of dehydration, which include excessive thirst, dark urine, fatigue, and dizziness. Avoiding diuretic beverages, such as coffee and alcohol, which can increase fluid loss, is also an effective strategy to maintain hydration and, consequently, kidney health. Adopting these practices in daily life not only benefits the kidneys, but also promotes a general state of health and well-being. Diet plays a crucial role in kidney health, with certain foods being harmful while others bring significant benefits to the kidneys. Foods high in sodium, sugars, and fats, especially saturated in trans fats, can increase blood pressure and the risk of developing chronic kidney diseases. Excessive consumption of proteins, particularly from animal sources, can also overload the kidneys, as it increases the amount of nitrogen waste they need to filter. Additionally, processed and cured foods, rich in phosphates and chemical additives, can be harmful to proper kidney functioning. These elements, when consumed in excess, require the kidneys to work harder to excrete them, which, over time, can lead to a deterioration of kidney function. On the other hand, a diet rich in fruits, vegetables, whole grains, and lean protein sources can be beneficial for kidney health. Foods such as berries, apples, cabbage, spinach, and fish rich in omega-3 are known for their anti-inflammatory and antioxidant effects, which can help reduce the risk of kidney diseases. Moreover, maintaining a balanced intake of potassium helps regulate fluid balance and nerve function, which is vital for kidney health. Adequate hydration, especially through the consumption of water, is essential to help the kidneys filter and remove waste from the body efficiently. Adopting a balanced diet, rich in nutrients and low in processed foods and harmful substances, is fundamental to keeping the kidneys healthy and promoting overall well-being. The relationship between blood pressure and kidney health is deeply intertwined, as hypertension is both a cause and a consequence of kidney diseases. The kidneys play a crucial role in regulating blood pressure, filtering excess fluids and salts from the blood, and thus maintaining blood pressure at healthy levels. When blood pressure remains elevated for extended periods, it can damage the renal blood vessels, reducing the kidney's ability to function properly. This damage to the blood vessels decreases the efficiency of renal filtration, leading to a vicious cycle where compromised renal function can result in a further increase in blood pressure. Therefore, controlling blood pressure is essential not only for cardiovascular health, but also to prevent or slow the development of chronic kidney diseases. To keep blood pressure under control and protect kidney health, adopting a series of lifestyle strategies is recommended. Firstly, a healthy diet rich in fruits, vegetables, whole grains, and low in salt and saturated fats can help reduce blood pressure. Regular physical activity is also crucial, as it helps strengthen the heart, lower blood pressure, and maintain a healthy body weight. Additionally, limiting alcohol consumption and avoiding smoking are important measures, as both can raise blood pressure and cause additional damage to the kidneys. In some cases, the use of medications prescribed by a healthcare professional to control hypertension may be necessary. Adopting these approaches consistently is vital for maintaining kidney health and preventing complications associated with high blood pressure. Diabetes significantly affects the kidneys through a process known as diabetic nephropathy, one of the most severe complications of diabetes. This condition occurs when excess blood sugar damages the small blood vessels within the kidneys, compromising their ability to filter waste efficiently. Over time, the accumulated damage can lead to progressive loss of renal function, resulting in chronic kidney disease or, in more severe cases, kidney failure. The early stages of diabetic nephropathy may not present obvious symptoms, making regular monitoring of renal function essential for those with diabetes to detect and treat any problems as soon as possible. To protect the kidneys when having diabetes, effective management of the condition is crucial, which includes strict control of blood sugar levels and blood pressure. Adopting a balanced diet, rich in nutrients and low in processed foods and added sugars, is crucial for maintaining blood glucose levels within healthy limits. Regular exercise also plays an important role, helping to manage diabetes and blood pressure in addition to contributing to overall kidney health. Moreover, continuous monitoring of blood glucose levels and adherence to prescribed medications, as recommended by healthcare professionals, are essential to prevent the progression of diabetic nephropathy. These measures, combined with regular checkups, can help minimize the renal risks associated with diabetes and promote a better quality of life. The consumption of toxic substances such as tobacco, alcohol, and illicit drugs has a significantly negative impact on kidney health. Tobacco, for example, contains chemicals that can damage the blood vessels of the kidneys, compromising their ability to filter blood efficiently. Excessive alcohol use, in turn, can lead to dehydration and alter the normal functioning of the kidneys, in addition to increasing the risk of developing high blood pressure, a known risk factor for kidney diseases. Illicit drugs, such as heroin and cocaine, can cause direct damage to renal tissues and provoke severe conditions, such as acute kidney failure. The combination of these substances exponentially increases the risk of renal impairment, highlighting the importance of avoiding their consumption for the preservation of kidney health. To prevent renal damage associated with the consumption of toxic substances, it is essential to adopt effective strategies to reduce or eliminate the use of these substances. Awareness programs about the risks of smoking, alcoholism, and the use of illicit drugs can provide valuable information and encourage individuals to seek help to overcome dependencies. Implementing healthy lifestyle habits, such as maintaining a balanced diet, engaging in regular physical exercise, and ensuring adequate hydration, can also help strengthen the body against the harmful effects of these substances. For those struggling with addiction, seeking professional support and treatment programs can be a crucial step in the recovery journey and protecting kidney health. Adopting these preventive measures not only benefits the kidneys, but also contributes to an overall improvement in health and well-being. Regular physical exercise brings numerous benefits to kidney health, acting as a powerful ally in the prevention and management of chronic kidney diseases. Physical activities help control blood pressure, reduce the risk of developing type 2 diabetes, one of the main causes of chronic kidney disease, and improve blood circulation, thus facilitating the kidneys' work in filtering blood and eliminating toxins from the body. Additionally, regular exercise contributes to maintaining a healthy weight, reducing pressure on the kidneys, and minimizing the risk of kidney diseases. Studies indicate that physical activity can slow the progression of kidney disease, especially when combined with other healthy lifestyle measures, such as a balanced diet and stress control. When it comes to exercise recommendations for kidney health, it is important to choose activities that suit individual fitness levels and are enjoyable to ensure consistency and long-term sustainability. Aerobic exercises, such as walking, swimming, cycling, and light jogging, are particularly beneficial as they improve cardiovascular health and circulation without overburdening the kidneys. It is recommended to engage in at least 150 minutes of moderate-intensity aerobic activity per week, according to general health guidelines. Additionally, strength training exercises, such as light to moderate weightlifting, can help increase muscle mass, improving overall health and the body's ability to regulate blood sugar and blood pressure. Before starting any exercise program, especially for those with existing renal conditions, it is advisable to consult a healthcare professional to ensure that the activity plan is safe and suitable for individual needs. Regular monitoring of renal function is essential to detect early signs of dysfunction and initiate appropriate treatment, helping to preserve kidney health over time. Various tests and examinations can be used to assess kidney health, including blood and urine analyses that measure levels of substances such as creatinine and urea, indicators of how well the kidneys are filtering blood. Another important test is the estimated glomerular filtration rate, eGFR, which indicates the volume of blood filtered by the glomeruli in the kidneys per minute and helps determine the stage of renal function. Albuminuria, the presence of albumin in the urine, is another critical marker, as its presence can indicate early renal damage. Diagnostic imaging, such as renal ultrasounds, can also be performed to visualize the structure of the kidneys and identify any physical abnormalities or obstructions. The recommended frequency for monitoring renal function can vary depending on individual factors, such as age, medical history, the existence of pre-existing conditions, such as diabetes or hypertension, and the stage of any previously diagnosed kidney disease. For healthy individuals without known risk factors for kidney disease, an annual checkup may be sufficient. However, for those with elevated risk conditions, such as diabetes, hypertension, a family history of kidney disease, or advanced age, more frequent evaluations may be recommended, possibly semi-annually, or as advised by a medical professional. Following the recommendations of a healthcare professional to ensure timely and adequate monitoring is crucial, allowing for early interventions that can significantly slow the progression of kidney disease and improve the quality of life. In addition to hydration, another essential practice in kidney protection is adopting a diet that promotes kidney health as a whole. Consuming a balanced, nutrient-rich diet is essential to prevent the development of conditions that can adversely affect the kidneys. Reducing the consumption of processed foods, excess salt and sugar is crucial, as these food components can contribute to increased blood pressure and other health problems. Regular physical activity is also a key component in protecting the kidneys. Exercise promotes cardiovascular health, helps with weight control, and contributes to the body's overall well-being. A balanced diet rich in fruits, vegetables, and low in salt and excessive animal proteins also plays a crucial role in preventing kidney diseases, minimizing the workload on the kidneys and avoiding the accumulation of harmful substances. Additionally, it is important to avoid excessive use of non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, which can cause renal damage when used frequently or in high doses without medical supervision. To avoid kidney injuries, physical protection measures and maintaining a healthy lifestyle are essential. Activities that may expose the kidneys to direct trauma, such as contact sports without the use of appropriate protective equipment, should be practiced with caution. Managing underlying medical conditions, such as diabetes and hypertension, is vital, as these diseases can lead to renal damage over time if not properly managed. Quitting smoking is a vital step in preserving kidney health, as smoking can compromise blood flow to the kidneys and significantly increase the risk of developing kidney disease. Tobacco contains toxic chemicals that can damage blood vessels, impairing the efficiency of the kidney filtration system. Additionally, smoking is associated with increased blood pressure, further exacerbating the stress on rinsing. By adopting preventative strategies, such as quitting smoking, maintaining a balanced diet, exercising regularly, and monitoring blood pressure, it is possible to mitigate risk factors for kidney health. Chronic stress, often underestimated in its impact, plays a crucial role in kidney health, influencing the kidneys directly and indirectly. When the body faces stressful situations, it triggers a hormonal response that includes the release of cortisol and adrenaline. These hormones, in an attempt to prepare the body for immediate action, can result in increased blood pressure. Persistent elevation in blood pressure places an additional burden on the kidneys, organs responsible for filtering blood and regulating fluids in the body. Moreover, prolonged stress can lead to health-damaging behaviors, such as poor eating, excessive alcohol consumption or substance use, and neglect of self-care, exacerbating the risks to kidney health. Stress can also worsen pre-existing conditions, such as diabetes and hypertension, which are significant risk factors for kidney diseases. Therefore, effectively managing stress is crucial to prevent damage to the kidneys and maintain healthy kidney function. Adopting stress reduction techniques can be extremely beneficial for kidney health, contributing to a more balanced and healthy lifestyle. Practices such as meditation, yoga, and deep breathing exercises can help lower stress levels, promoting relaxation and well-being. Regular physical activity is another effective strategy, as it not only reduces stress, but also helps control blood pressure and weight, important factors for kidney health. Additionally, ensuring adequate sleep, maintaining a healthy and balanced diet, and establishing a strong social support network can assist in managing stress and promoting overall health, including kidney health. Recognizing the need to seek professional help when necessary is also an important part of stress management, ensuring that effective strategies are being used to protect kidney health and overall well-being. And so, we reach the end of our exploratory journey on kidney health. But remember, this is just the beginning of your personal adventure towards a healthier lifestyle. The question that remains is, what will you do next? How do you plan to apply these findings to your daily life to protect your valuable kidneys? Can small changes truly pave the way for major transformations in your health? Do not see this moment as an endpoint, but rather as a springboard for action in favor of your kidney health. The key to keeping your rinse healthy lies in the daily choices you make. It could be a decision to increase your water intake, reduce your consumption of foods high in sodium, incorporate regular exercise, or monitor your blood pressure. Every small habit contributes significantly positively to long-term kidney health. Commit to one change at a time and celebrate progress, as each step, no matter how small, is valuable on the ongoing journey to well-being. We look forward to hearing about your experiences, ideas, and questions. What topic related to kidney health or wellness would you like to explore next? Share your reflections, because by extending this conversation, we can expand our knowledge and improve our healthcare. Until next time, Stay curious, motivated, and above all, healthy. Remember, the power to change is in your hands, and we are here to support your journey to a healthier, more balanced life.